Go.
Hi. My name's Courtney. I'm your nursing student today, and I'm going to talk to you about the drug you just got put on.
Okay.
What's your name?
Hannah.
Hannah. And then who is this?
This is Hank. This is my boyfriend Hank.
Hank? Okay. How old are you, Hannah?
21.
21. Okay. Do you know what drug you're on today?
Ranitidine.
Yeah. Ranitidine. And then the trade name is Zantac. Okay? And then, do you know what this does for you?
I think it's something to do with my stomach.
Stomach? Yeah. So the mechanism of action is that it inhibits the histamine at the H2 receptor and the parietal cells of the stomach, which inhibits secretion of gastric acid. Okay? So today we're going to give you a shot. It's an IM shot, intramuscular, and it won't hurt very bad, I promise. It's given 50 milligrams every 6 to 8 hours. It can also be given PO, by mouth, or by IV, but we were told that it's...
Well, why can't I just have it orally?
Because I said so. Alright, so we're supposed to give this into a large muscle mass, and it's a diluted substance. So I'm going to give it into your deltoid. Alright. Ouch! Okay, it's all good. You're only bleeding a little bit. Okay? It's all done. Anyways, Hank, do you have any questions?
He's not allowed to talk about the wedding.
Okay. Well, Hannah, do you have any other questions?
Yeah, I was wondering, what do I need to avoid? Like, is there any foods or anything?
Okay. Well, you should not be taking, do you take any antacids?
Yes, I take one.
Okay, so you need to make sure that you take that an hour before or an hour after you take Ranitidine. Okay? And then, like I said earlier, for the IM route, you're going to have to dilute it and give it into a large muscle mass. So you and Hank, when you guys go back after this, that's what you'll be doing. And give it into the deltoid. You can switch injection sites. And then this is contraindicated in hypersensitivity, renal hepatic disease, and breastfeeding. Are you pregnant by chance?
No.
Well, if you plan on getting pregnant, there's not that big of a concern since it is pregnancy B category. Okay? And then children under the age of 12 should not take this. And your side effects that could happen by taking this drug include headache, dizziness, constipation, pruritus, skin rash,
So itchy.
gynecomastia,
What?
decreased libido,
Hank.
and impotence. Okay? And the serious adverse effects that could occur are hepatotoxicity,
Oh, my liver.
acute interstitial nephritis,
My kidneys.
pneumonia, and anaphylaxis.
Oh.
Okay? For this, what nurses need to do are monitor your gastric pH, BUN, and creatinine levels. You should avoid alcohol, caffeine, and spices because those cause gastric irritation. And also, you should not drive in a motor vehicle until stabilized on the drug. So when you leave the hospital, it's recommended that Hank drive you home.
Okay.
All right, you need to report your pain, coughing, or vomiting of blood if any of those occur. Okay, any other questions?
No, I don't think so.
All right, well, you
Thank
have a
you.
great day.
Mhm.
Thank you.
Don't look at my boyfriend.